Hello everyone. Today we're going to talk about the hangout interval in cardiology. So hangout interval is nothing but, so we should know before that what is second heart sound. Second heart sound occurs due to the closure of the aortic and pulmonary valve. So for closure of the aortic and pulmonary valve, what should happen is that, so supposing this is a cardiac borders, this is the right atrium, left atrium. This is left ventricle and right ventricle. So from the right ventricle part, if we take it separately, so what happens is supposing this as right ventricle. So from right ventricle, what arises is the pulmonary arteries, that is the main pulmonary and the bifurcation here. And here is the pulmonary valve. So for the pulmonary valve to close in the systolic phase, what happens is that the right ventricle contracts and the right ventricle pressures are higher when compared to the pulmonary artery pressures. So thus the valve remains open throughout. Now when the ventricle is contracting completely, after a certain phase when the complete emptying has occurred, the pressure starts dropping here. So systolic pressure will drop. That is RV systolic pressures will drop. And when the both of the pressures, that means the pulmonary artery pressures and the systolic pressures of the right ventricle, if both becomes equal, then ideally there should be closure of the valve. That means the closure of the pulmonary valve. So normally what we think is that whenever the both the pressures of the right ventricle and pulmonary artery, similarly left ventricle and aorta, when both of these pressures become equal, that time there should be, whenever there is a crossover, that means that if the aorta pressure gets more than the left ventricle or pulmonary artery pressure gets more than the right ventricle, then the valve should close. But this does not happen. There is some lag between that, and that lag is called as hangout interval. So what I mean to say by that is that that means that when the RV pressures has decreased to lesser than the pulmonary artery pressure, it does not close immediately, but there is some gap, and that gap is called as hangout interval. So this gap is found to be more in pulmonary artery when compared to the aorta. And in aorta, it is said to be 30 milliseconds, whereas pulmonary artery, it is said to be 80 milliseconds. That's why whenever we say that there is a split, we say that A2 comes after P2. So although we all may assume that because left ventricle has larger volume, it should take larger time to empty and AT should come late. But this does not happen like that. So it both depends simultaneously on the hangout interval, and P2 has a greater hangout interval when compared to the A2, that is the iota. So that's why the A2 occurs initially followed by the P2. So what we have to understand is that supposing that this is the right ventricle and this is the valve here and this is the pulmonary artery. So right ventricle, pulmonary artery. So what is most important is not the total pulmonary artery pressure, but what is the pressure exactly next to the valve. Supposing this is the pulmonary valve, what is the pressure next to the valve? So if this pressure is more when compared to RV, this valve will close. So how does this pressure is determined by? This pressure is determined by one thing, two things. One is the compliance of the pulmonary artery, compliance, or what I mean to say is the distensibility of the pulmonary artery. Suppose the pulmonary artery is more distensible. So what will happen is that after the RV has emptied into the pulmonary artery, this pulmonary artery can be more distensible. That means it can stretch more and more. So when it stretch more and more, if there is more volume stretch can be there, lesser will be the pressures here. So that means decreased pressure at the junction of the pulmonary artery here. So pressure is not rising more when compared to the RV. So that's why there is some lag, and this lag is called as hangout interval. So what I mean to say is that when compared to the aorta, pulmonary artery has one is the lesser pressure because as we know that aorta is a systemic pressure, so aorta will have normally high systemic pressures when compared to pulmonary artery. Second is pulmonary artery is more distensible, So these two features, that means the decreased pressures at this part and also the more distensibility, makes this that this pulmonary artery, the pressure next to the valve does not rise immediately even after the crossover of the pulmonary artery with the right ventricle, and there is some lag, and that lag is called as hangout interval. So hangout interval is the time delay between the point at which the pressure in ventricle falls below the pressure in the arteries and the actual closure of the semivalvular valves. It occurs due to the elastic recoil, as we have discussed. So hangout interval is the time between the crossover of pressures and actual occurrence of the second heart sound. So why does it occur is first, as we have discussed, first is because of the elastic recoil. So elastic recoil maintains the forward blood flow momentarily after pressure crossover. That is important. What is the pressure beyond the valve? It also influences that. So aorta has a higher pressures when compared to the pulmonary artery. Thus, pulmonary artery has a lesser pressures at the valve region. Also the vascular impedance, that means the vascular resistance, and the respiration. So respiration means what happens is during inspiration more blood is towards the right side, so increase right side blood flow. So that means what will happens is that there is increased flow, that means there is increased distensibility and also more blood is going. So that's why what will happens is that the hangout interval will be more and more prolonged. So A2 will be more than P2. So this distance keeps increasing. So normally in aorta it has a shorter interval because it has higher pressure and less distensibility. Pulmonary artery has a longer interval due to lower pressure and greater distensibility. So what are the factors which influence hangout interval is the pressure beyond the valve, dilatation of the artery, distensibility of the arterial system, vascular impedance or resistance, and the phase of respiration. So it helps diagnose the conditions like aortic or pulmonary stenosis and pulmonary hypertension, alters the split between the A2 and P2 components of the second heart sound. Thank you.